Hello, my name is Lucas Isenhower, and I'm currently finishing up my baccalaureate degree in nursing. I originally started nursing uh, about 5 years ago, 6 years ago, actually. I was a licensed vocational nurse for 3 years, and I worked at St. Elizabeth Minor Care for 3 years. During that time, I learned a lot. I cared for a lot of people, cared from elderly to just a few weeks old patients. Um, After that, I worked towards my associate degree of nursing, which I have been for 3 years now. I, I obtained my associate's degree at Angelina College in Lufkin, Texas. Since then, I've worked in St. Elizabeth's cardiovascular intensive care unit, where I've learned a great deal of skills. I currently take care of bypass patients, patients that have had AAA surgeries, AAA stents, heart caths. We take care of a wide range of patients. During my time working at St. Elizabeth, I have obtained my ACLS and CCRN certifications. The CCRN was very difficult, time consuming, lots of studying, but it was definitely really worth it. I believe working in the ICU has definitely helped me get through the BDSM courses. During this time, I've used my critical thinking skills I've acquired throughout the years to apply towards my work, and I believe that is one of the reasons I've been successful at completing these courses. During these courses, we have met 7 outcomes, and that's what I'll talk about next. The first outcome, practice a safe and effective holistic patient-centered care to a variety of patients, clients, in multiple settings from a global perspective by incorporating theories and evidence-based findings. I completed this objective or outcome in care of the communities class, and the project that I actually believe I completed it on was a practicum project teaching plan 4, and I believe I accomplished that at 90%. Outcome 2 is completed in the compromised multi-health states class. Outcome 2 is supports patients, clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. And I completed this outcome on the assignment practicum project teaching plan with, I believe, an 85%. Outcome 3 is evaluates patient-centered care for patients, clients across the lifespan based on common and complex health needs and compromised health states when considering multiple determinants of health. I completed this compromised multi-health states course, and the project was project video number 5. I believe I completed that with an 85%. Outcome 4 synthesizes clinical and judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. I completed this outcome in the nursing inquiry and evidence-based practice course, and the assignment was quantitative research article activity. I believe I completed that with a 90%. Outcome number 5, employ safe, effective, patient-centered care using the theories and evidence-based findings in collaboration with patients, clients, and members of the interprofessional and intra-professional healthcare team. The course I completed this outcome in was Leadership and Management in the Healthcare System, and the assignment was Global Health PowerPoint presentation, and it was a 95%. Outcome number 6 differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients, clients. As a member of the interprofessional and intra-professional healthcare team, I believe I completed this in Leadership and Management in the Healthcare System course. The assignment was clinical application, practicum assignment, 95%. Outcome number 7, demonstrate professional integrity, effective communication, active inquiry, and service to the community. Nursing theories and online education is the course I believe I completed this in. And the assignment was differentiated essential competencies paper with 95%. During my time at Lamar, I've definitely learned a great deal of information, and I plan to continue furthering my education by applying for either a nurse practitioner program or a certified nurse anesthesia program, both of which Lamar doesn't have, but they have been a great program for the BSN program. My 5-year plan also includes joining nursing organizations. Currently, I'm a member of the AACN, which is very critical when you work in a critical care area. They show a lot of evidence-based practice. They send out a monthly magazine that shows a lot of research and what goes into evidence-based practice. And I apply that towards my work daily. Also, want to continue caring for patients using evidence-based practice, learning through CEUs and other reputable sources. I would like to continue working in the cardiovascular ICU while I can, but eventually I would like to broaden my skills and work in a different part of the hospital. But for now, I'd like to thank Lamar University and all the instructors for helping me achieve work towards my baccalaureate program degree.